I was really attracted to UCSD because I could really see myself growing into the physician that I want to be through this program. It has great people that are willing to teach me, and it has everything that I'm looking for in extracurricular stuff when it comes to emergency medicine. The hyperbarics program, the wilderness medicine program, and the global health program are all superb here, and that's what I was looking for in a program.
I think UCSD is a great program academically. I think I didn't really interview anywhere else that had as many options for you to explore as far as subspecialties, while also putting a lot of focus into just, the basics of emergency medicine. I think you should look at a place where you're going to be happy, where residents are happy to be around each other, they interact well with each other and with the faculty, and I definitely have had that experience so far at UCSD.
So the thing that sets UCSD apart from other residency programs is both the relationship between the residents and the faculty and the relationship between the ER and the other specialties. And additionally, UCSD is one of the best programs in pretty much every other specialty. So the other residents that you work with are just top notch, and I don't think that you get that anywhere else.
The Hillcrest ED is a very busy emergency room as well. There's never really a time where you're just kind of sitting there waiting for lab results. You're constantly moving the entire time you're on shift.
Sometimes it can get pretty crazy here, and I think we have patients in Hillcrest, San Diego that are pretty unique in the country, and we see a certain demographic that many other residencies don't see.
We see patients here who haven't seen a doctor in years and have lack of access to health care, and a large homeless population here in San Diego, as well as a lot of tourists here on vacation. So you kind of get the whole spectrum of patient population. It's a very wide breadth of patients here.
Of course, UCSD is a very large academic center up in La Jolla. Here in Hillcrest, we have a little bit more of that county flavor. Because of all these different places that we rotate at, I really think it gets you just like that extra special something that helps you really become a really well-rounded emergency physician. In the ED, the PGY2 role really is to be the workhorse of the department, to see as many patients as we possibly can. The R2s are also responsible for a lot of the procedures that have to be done on the sick patients: intubation, central lines, art lines, arthrocentesis, reductions. Those all fall under the purview of a PGY2. In addition to that, a lot of us choose to rotate on Mercy Air as flight physicians, and that also gives us that pre-hospital care that you might not get at a different program.
I'm in the middle of my Mercy Air training experience right now, which is a month of intensive work operating in the helicopter and performing scene calls and interfacility transfers. And it's an incredible supplement to my education here at UCSD, and it's a huge thing that sets us apart because we're really the only program where I get to fly and replace the paramedic there. Getting to go there and work on my own without that attending support present really helps me sharpen and hone my clinical skills.
I feel lucky in that San Diego has one of the best children's hospital institutions in the country. That's being Rady Children's Hospital, which is a large catchment area for not only San Diego County, but takes many transfers in from places like Imperial County and even Orange County. Rady's is a huge tertiary pediatric academic center, and we spend multiple weeks there every single year learning just dedicated pediatric emergency medicine from pediatric emergency trained physicians. And I think that's what really stands apart, is that you are getting specialists in pediatric emergency medicine, teaching you all the things and skills that you will need to know to be a competent emergency medicine physician taking care of kids.
El Centro Regional Medical Center is located about 2 hours east of San Diego. It's a little bit of a drive to get out there, but it's actually a really pretty drive, in my opinion. It's really the main community hospital in the area. But right next to the hospital, our residents actually have an apartment complex and a house itself that we get to stay in, so we don't actually have to use our own funds to stay out there for the 2 weeks that we do for OBGYN or when we're out there working in the emergency department.
So the VA rotation is pretty unique in the way that they set it up for second-year residents, the way that we get to kind of run our own fast track or our triage experience. I just came off of my VA rotation, and it was great to just be able to see patient encounters from the beginning to the end and run up the full workup. Additionally, they're kind of creating the VA experience to also be a good teaching opportunity with simulation. in the way that we can have a more teaching role as a mentor and as a teacher to younger years, such as the interns that are also working through the VA, interns from other specialties, and even medical students.
Boot camp basically takes you through your training, so your ACLS or ART training, your PALS training, and then you get a ton of ultrasound training during boot camp as well, which I thought was really amazing to get. I'm also interested in ultrasound, and it's something that you use clinically on almost every single shift, and it helps you make medical decisions for the patient right then and there. So it really eases you into the transition to becoming a physician.
I think one benefit of this program is that we have a lot of faculty who are fellowship trained in a variety of the EM specialties, which as a learner is great because by the end of my 4 years here, I will feel comfortable in each of these specialties without having to do an additional year fellowship. I'll already feel like I can hit the ground running as an attending.
One of the real values of the program is that despite them having all that experience, they are still very relatable, and it's an easy relationship in the doc box. We all sit next to each other, and it's really casual presentations and low pressure.
The other thing that's really nice about our program is we welcome a lot of other residents to come rotate down with us in the emergency department, so they also get a taste for what it's like to be an emergency physician. All of this ends in services that work with us, especially as you get later on in your career as a 3, as a 4, you know almost all of the people you're admitting to, and we have a great relationship because of that.
Choosing UCSD was also choosing a city and location where I could start a family. And UCSD specifically, because the 4-year program has more elective time, so I feel like I can live my life as I'm going through residency, and it's been nice to balance those things and have been able to do so here at UCSD.
Everybody's on a first name basis, it's all friends, family, they all know each other's spouses and kids, and I think I look up to a lot of the people here at the program like they're my own family.
I think San Diego itself really provides a lot of opportunities to interact with your residents outside of the emergency room. We have a lot of program-sponsored events, but there's also a lot of opportunities outside to go to the beach, to go have a bonfire down at the beach, to go surfing with a bunch of co-residents. The food scene, the nightlife, everything in San Diego kind of feeds itself into a really good social experience here in San Diego.
I think you can find any type of group or any type of person activity that you want to here at UCSD, and I think the weather, the ability to go outside is pretty suitable for any person who wants to do emergency medicine. So I think whatever you want to do outside of work, you have the opportunity to do here in San Diego.
There's a lot of great programs out there, and I think what you should look for is not what's on paper, the perfect program, but more like what's the perfect program for you. Find a place that you think you're gonna grow to be a happy and successful clinician. If you like big city but without a lot of the hassle, you like great weather, you like good food, then I think UC San Diego is a spot you should consider.